I was crazy, and some people just flat out told me that it wasn't going to work. But I really believed that when I went to medical school and deciding my residencies, that I wanted to hold to the idea that helping people was going to be at both my direction and at the direction of what people wanted and expected. Good morning, everyone, and welcome to the Richard Kim Medicine Podcast, the medicine that moves you. I'm Dr. Richard Kim, and today I'm actually the guest on the episode. We're here today with the Chief Clinical Nurse, Cragen Orleman. Say hi, Cragen.
Hi, how's it going? Thank you, Dr. Kim. Today's episode, we're going to be diving into a little bit about Dr. Kim's background and exploring the topic of stem cells and what stem cells can offer for you, for our patients. And first, let us just, kind of get into, the who, what, where, when, why of Dr. Kim. So, Dr. Kim, can you tell us a little bit about your background, your upbringing?
Yeah, definitely. So I was born and raised in Southern California and went to college and high school in Seattle, Washington. Made my way out here for medical school, and I've been here since medical school, residency, and fellowship. About a year or two after I finished my fellowship, I decided to start a primary care sports medicine practice.
So what I guess piqued your interest into sports medicine? Why sports medicine and not another type of specialty?
I went through what is called a general residency of internal medicine and pediatrics. So we do two residencies basically at the same time. And getting through that, I really developed an interest in preventative medicine and trying to help people combat some of their diseases with diabetes, high blood pressure, high cholesterol. The thing that I recognized early was that exercise was the key to much, if not all of that. Doing something like primary care sports medicine was interesting because there was some procedure, there was some preventative medicine, and the mechanics of people's bodies was something that had always interested me.
Tell us about what that was like, starting a private practice, especially when in today's environment, private practice is all but disappearing, and it seems to be pretty hard to survive given insurance and larger physician groups.
Yeah, I mean, it definitely wasn't the popular move. A lot of people told me that I was crazy, and some people just flat out told me that it wasn't going to work. But I really believed that when I went to medical school and deciding my residencies, that I wanted to hold to the idea that helping people was going to be at both my direction and at the direction of what people. When we first started the practice, it was quiet. There were days where we would see 1 to 2 patients and maybe none. But as the practice started to grow and to get busy, I remember at times we'd be sitting there with a patient with hip pain and say, all right, well, here are your sort of conventional methods of treating that hip pain. But after about 2 or 3 different alternatives, we would run out of suggestions and ideas. And that was really unsatisfying. We really wanted to be able to expand what we offered to people. And in some cases, surgery either wasn't an option or was not a favorite option. That's when we sort of started to look at regenerative medicine as a real source of alternatives for people. Looking into it, we realized that it was really satisfying in that the materials come from you, get injected back into you. So there's an inherent safety about it. It gave people not just days or weeks of improvement, but something that could last for years. So something like that really talked to the not just the independent side of having our own practice, but also talked to the preventative side of why we really went into medicine. It was to try to help people do more with what they had, basically.
I wasn't here in the initial startup when you first established the practice, but I can tell you now that we certainly aren't waiting for patients. It seems that word of mouth has done a lot of good things. You say it all the time. It's your catchphrase. The proof is in the pudding. These types of therapies, they're a really great option for people who are looking to avoid surgery or prolong push-out surgery, or people that can't even have surgery due to other underlying comorbidities. So what would you say, or how do you describe where the practice is now?
The early days when you're talking about things like regenerative medicine, and a lot of that is either platelet-rich plasma or, in our case, stem cells, you're really introducing something new to the community, to the current atmosphere of medicine. And that's not always a popular or always trusted. And so it really took a decent amount of building people's trust to looking at and trying these sorts of therapies. Doing the research and watching other people's practices made it evident that these sorts of things and these kinds of therapies would work. It was just really about trying to break into the sort of set ways that people thought about some of these problems. The development of the practice then, once people saw that it was a real and viable option, then really sort of took off. And for a while, we just focused on what we did and how we did it, and then just let the practice grow on its own. It's a little bit different now. Obviously, it's a much bigger presence in our practice, and we focus on it, and we not just go around and do seminars and do forums of it, but it's something we wholeheartedly believe in, and I guess we're less afraid to go out there and tell people so, and show people our results. And it's nice in that we have this year's worth of information and data to show them that it's a real and viable option for people.
Because in the long run, the whole goal, the end goal, is really getting our patients moving, right?
Yeah, I mean, if you look at the fundamental problems that sort of face our country today, it's the rising rates of diabetes, high blood pressure, high cholesterol, and then ultimately heart disease, right? The combination of all those things really leads to heart disease. No matter how much we talk about treatment of diabetes, new medications, new therapies, new injections, new pills, the thing that uniformly affects all of those things, and including heart disease, is movement and getting people to exercise. The faster, quicker, and way we can make that happen is, in my mind, the most successful, not to mention the most minimally invasive method in getting there. So it really, our focus in the practice is, yes, orthopedic medicine, yes, joint disease, yes, osteoarthritis. But the other side of that is, guess what? If all those things hurt less, you're more likely to go out there and go for that evening mile walk or go for that hike, which you thought previously was not possible. And it does a lot for you. It makes you feel better, sure, mentally and from a mood standpoint. But that it's also doing something for you from a physical profile standpoint.
Regenerative medicine, stem cell therapy, define that a little bit better. Because a lot of people think, when they hear the word stem cell, they think space age medicine or futuristic medicine that really doesn't exist yet.
Yeah, I mean, think about the number of times, Craig, that we sit in this office and people come in and they're like, will this regenerate my cartilage?
Am I going to have a brand new knee like when I was 12 years old?
Right. And I think pretty definitively we know that that's not what's going to happen. There's no turning back the clock. Maybe someday down the line, as the science and the medicine gets better, we can think about that sort of space age type of medicine. But at this point, we're not there yet.
Yeah, you can't quantify the cartilage that is grown. That is essentially the theory behind stem cell, right? It's seeing how much cartilage or potentially growing cartilage in a knee, or those are some of the questions that people ask. They ask, how much cartilage grows in my knee after a stem cell therapy? Is that the focus, or?
We're shifting away from that focus the better that we get into the science here. What we understand now is that from these cells and these things that we inject into people's knees and their shoulders and their tendons and rotator cuffs, is that it's not about trying to turn back the clock and undo the damage that the previous 60 years of life had done to you. It's about the disease process, and much of the disease process is about pain and subsequent inflammation. If we can take these materials, which by and large control the inflammation and the pain, I think we're drifting away from the focus that, yes, we need more cartilage in order to have no pain, when in fact it's about controlling the osteoarthritis to have no pain. So a lot of this idea of regenerative medicine, that we are truly regenerating something, is probably a little bit overstated. What we are probably doing is revamping the local environment that sort of led to that pain, led to that inflammation. And, unfortunately, with marketing and what people's are more likely to gravitate, the words like regenerative and stem cell medicine probably are here to stay.
So, in other words, it's a way of reducing pain in the joint so that people can start moving, they can start participating in activities that they were once not able to do because of pain limitations. Is this change of environment, is it a permanent type of change, or is it something that due to life and diet can kind of go back to the way it was?
Yeah, I mean, on one level, you can't really pick your parents. And so if you've got the bad genetics for bad knees and bad joints, no amount of injection of stem cells is gonna undo that. The underlying theme here, though, is that the thing that originally created the pain is something that can be controlled. And so that's really what the focus of what we're doing is going to be based on. The pain of which some of this environment has created is the thing that's limiting people and their activity.
I've heard you say in the past, it's like it's a vicious cycle. It's this cycle of degeneration brought on to cause pain, to then cause inactivity, which then in turn causes more degeneration.
Yeah, I mean, a couple times a week in our office, I probably talk to somebody who says, I developed this knee pain, and because of the knee pain for the last 6 months, I haven't been able to exercise. I haven't been able to get on the treadmill, can't walk the dog, and now I'm gaining weight. And because I gained weight, I'm unhappy. What we know is that, when you develop the pain, you're creating both instability, which then leads to your inactivity, because you're just not confident that you can go out there and do something and either not be in pain or not cause further injury. But even if you don't go out there, the instability is putting you at risk for future injury. So for us, it's that cycle. It's identification of that cycle. And even if we talk about, well, who's the right person for these sorts of therapies, it's that person, right? It's that person who recognizes that this vicious cycle is happening to them, even if they don't recognize it as a cycle. The person who sort of sees that is probably the most likely to succeed in all of this. For us, it's not only taking that person, no matter where they are in that cycle, and trying to undo it. If we can get them to a point where they're pain-free, give them improved activity, and then, after that, give them better stability, then, we can sort of undo that cycle and undo that cycle for years at a time. Some of these therapies can last 3, 5, 7 years. And that's a pretty good thing.
So then how is this different than general pain management or orthopedics? Is it breaking that cycle like you were talking about, or is it, what would you say?
I mean, I think general pain management and orthopedics, we all have the same goal. How we go about achieving the goal is a little bit different. Pain management and orthopedics is about, I think, how I like to describe as subtraction, right? You're taking the joint out, you're trying to burn out nerves so that you don't feel it, and then hopefully get you back to that better part of that activity cycle. Regenerative medicine and stem cell therapy is really different because we're not taking anything out. Instead, we are adding things. And what we're adding is parts of your body that we know are instrumental in healing, instrumental in controlling inflammation and pain, and adding them to those locations, and therefore creating a longer lasting, more natural way of healing that environment.
So those parts of the body that we're adding, how do we know that they're doing what is intended? Is it because, they perform that function naturally in the body?
Yeah, I think that's the part where some of the science that we understand now is still developing. Whoever came up with this idea and started this idea were on the right track. And thankfully, we're able to look back at those people and see that doing these kinds of therapies is long lasting. I mean, when you have a therapy that lasts for years without big and significant and dangerous side effects and outcomes, probably wanting to know how that worked, but, less questioning about, why it worked, and just more sort of thankful for the fact that it is doing something for people.
Right. I think that's why I appreciate regenerative medicine, is because man has done its best at studying the human body and how it works. And, there's a lot that we still have yet to discover. But what we do know is, these cells, this material that we take from our patients and put back into them, they perform specific job functions. And we do know that for certain. And, we're allowing them to do their job, do those job functions in an environment where they wouldn't necessarily be allowed to perform those job functions.
And when you think about the people who come back to us, right, do you sort of feel like they come back and say, all right, so it's time to reassess the cartilage, it's time to reassess the arthritis? Or are they more of the mindset, all right, I'm just happy to be, not thinking about my back, my disc, right, my knee, whatever? Because
if it doesn't hurt, who cares?
Yeah, essentially. I mean, if we don't have to think about it and we can go back to what we do, that's sort of the ultimate goal.
Right. And a lot of people ask that when they're asking about, is this going to regrow cartilage? And, we haven't focused on that because, for the sake of devoting a lot of our time to our patients and ensuring that they get the best results from this type of therapy. And so, when I ask them what's more important, how much cartilage is grown or whether or not they have pain, 10 times out of 10, people focus on the fact that they have reduced pain, increased movement.
Yeah. Once we get to that point, I think we also have to recognize the fact that doing these procedures is part of the solution, but the other part of the solution is getting them back on their feet, getting them back to the treadmill, getting back to the hiking trails, and making sure that they continue to develop muscles and strength and flexibility. It really takes all of those things to create a long-lasting plan. I think too often we just look at it as all right, one and done. Everything should be miraculously.
But it definitely isn't that, right? The movement is what promotes the longevity of these types of therapies.
These sorts of therapies really act as the bridge. We're trying to get people to a point where they can participate or even build some of those strength and musculature and do the physical therapy and do the next parts of the rebuilding.
Yeah. So how then will people know or decide if this type of therapy is right for them?
I mean, we touched on it a little bit before, but a lot of pain management and orthopedics and even these sorts of therapies are what we call elective. You decide when it's the right time for you. Making the diagnosis is important, knowing how severe your arthritis is and how significant your pain levels or how significantly impacting to your activities of daily living are. We've had people in all sorts of categories, people who want to get back to running, or people who are just simply looking to walk their dog at night or get back to work without pain. Once you have the identification of the diagnosis and severity, deciding on when to do it is totally up to the patient. This just happens to be one more alternative to saying, all right, do we do steroids? Do we do surgery? And for those people who are looking for what else is out there.
So this people that are doing regenerative medicine out there.
Yeah.
What makes us different than a lot of the other physicians and facilities that are doing regenerative medicine and stem cell therapies?
Right. Regenerative medicine is becoming popular. The beginning parts of our practice and my practice was really focusing on being a good diagnostician and making sure that we had the diagnosis right, because not all knee pain is arthritis and not all knee pain is cartilage based. So understanding and being able to make not only a diagnosis, but a complete diagnosis, being able to understand everything that is dysfunctional in that back, that hip, and that joint. So that's certainly one thing. The other thing is that, we're a fairly small operation, right? So it's you, me, and two other people in the office. So we're really about taking care of one patient at a time, focusing on that one patient and making sure that patient's needs are met. And consequently, we have a pretty busy practice, and our number of patients per day are, somewhat limited. And we try to make sure that we don't overstretch ourselves in that way. The other part of our practice that makes us different is that our overall approach is different. We don't look at it as a one injection and out the door you go. For the most part, have a 14-week long process that's at least, if not more, 3 to 4 injections. So we have a pretty lengthy, involved program. We involve a dietitian for each and every one of our stem cell patients. And it's these sorts of small things that make a difference, getting close relationships with physical therapists. These are the kinds of things that I think you don't get necessarily from a larger practice. Being in a smaller practice, we really focus on the highest quality of each of these parts that make success.
Yeah, I can appreciate that. We definitely devote a lot of time to our patients that are receiving stem cell therapy. We're, a phone call away, able to answer any question that they might have as they arise while they're going throughout this 14-week process. And I think that's what makes it most successful, because, not only are they receiving a therapy that is not the norm or not popular, but they are able to, as questions arise, give us a call and then we're able to, get them the answers that they're looking for or help them with things that come up. Because like you said, that knee pain isn't just always, inside the joint. There's many complexities to joint pain, the body and the muscles.
Yeah, I mean, I think that the fact that our staff understands not just patients and understands regenerative medicine really makes it so that in kind of a no questions asked, when people call, we know exactly how to address them, we know how to help them, and we know what the next steps are in order to make them, not necessarily happy, but make them push them, or I guess push them towards a successful outcome. I think that's the part where having an office and working in unison and making sure that everybody is on the same page with all of that is the part that really makes a significant difference.
What are some of the things that these patients that are either considering or going through the regenerative therapy be concerned about? Or are there any pitfalls or
Yeah, I mean, I think we're getting to the stage where regenerative medicine, again, sounds super sexy and sounds like Star Wars, Star Trek kind of space age, and almost anything can happen. I think that's where some of the dangers lie, when people's expectations compared to where the current science and where the current level of care is don't quite line up. There's a lot of existing information about what we call embryonic products, both placental, amniotic, Wharton's jelly, umbilical cord, all of this sort of therapy. There's some countries out there who are using this and do find success with it. But here, currently in the United States, we don't have viable stem cells in any of those products. And unfortunately, a lot of people are getting marketed to, and a lot of people are going for these sorts of things. And quite frankly, it's dangerous. It's creating both dangers to the patient and creating dangers to the advancement of this field and this science. A lot of people are out there trying to help people and really sticking to the science that exists. And then there's some people who are just looking to take advantage of the fact that people are in pain and desperate for a solution and an answer. We're not where science fiction has said that we could be. And until that point in time, I think it's important that people really do their research. What does it mean to do your research, though, right? So less necessarily listening to this podcast is probably not enough, quite frankly. Going to reputable government-based or large institutional places is probably a good place to start. Looking at websites like Mayo or Johns Hopkins or the University of Southern California can start pointing people towards truly vetted information. This is the part I think that makes me a little bit sad, because it really threatens all the progress that we've been making and all the people that we could be impacting and helping. So I really, urge a lot of people to look at what they're doing and how it's being done before they make their decisions.
So for the sake of those, just tuning in, listening in, you had touched on that we use the patient's stem cells. What type of stem cells are they, and how do we get them? Where do we acquire them from?
Yeah, so at this point in this country, the only viable stem cell product is what we call mesenchymal stem cells. The mesenchymal stem cells that we extract come from people's bone marrow and from people's fat, and then reintroduced back into certain locations and to certain spots. The stem cells that we use are very different than embryonic stem cells. They've already been what we call differentiated. So they can only really become a certain number of different types of tissue and already have a certain amount of activity taken out of them. Whereas with a lot of embryonic products, the potential is essentially unlimited. Think sort of Dolly the sheep kind of idea. But yeah, so far in this country, the only thing that is viable, that is allowed, is what we call autologous, which means from you and back into you, mesenchymal stem cells.
So where do we get them for our patients? Where do we extract them from?
Our process is a 14-week process, of which one of those is dedicated to the stem cell portion. When we get stem cells, we're talking about pulling them from people's bone marrow, number one, and number two, from people's fat. So how that looks in somewhat detail here is that we take a a fairly decent sized needle and extract the center, which is a soft sort of material out of the center of people's bone, and it's called bone marrow. If you've ever had certain types of beef or cow bone, you'll know that that center is of a different color and a different texture. Essentially, we're taking that component. Adipose in our office is basically fat and no different than the basic liposuction procedure.
So is there a difference between the fat and the bone marrow?
Yeah, for the most part, fat and bone marrow differ in both quantity and in potency. So the ability of the bone marrow stem cells are a bit higher, but we know that they exist in lower numbers. And then adipose or fat has higher numbers, but we know them to have an inherent lower capacity and lower potential within them.
So we're taking people's stem cells from their body. A lot of the questions that I get from our patients that are advanced in years, they've heard from other sources that their stem cells are old and so they don't work, or they don't work well. Is there any truth behind that, or is that kind of?
Yeah, I mean, your stem cells are basically as old as you are. So if you're 75, guess what? Your stem cells are 75. The idea that a 75-year-old stem cell doesn't have potency or doesn't have capacity is simply not true. You can absolutely have parts of your liver, parts of your skin, parts of your body regenerate. And you know that because you exist, and it's not like your liver one day decides to fail and fall out of the bottom of your body like a transmission out of the bottom of a car. You know that it is still functioning and still regenerating. So therefore, you know that a lot of these stem cells that exist in other parts of your body have that same potential.
Not like you cut your hand and you have a cut for the
right. And
rest
it's
of your
not like
life.
you don't heal anymore. You do heal. Maybe it's a little bit slower, or it takes a little bit more time, or your skin's a little bit thinner, but you know that you have the ability to heal. There's probably two important things to consider here. Number one, there's a lot of information out there, and something like this, education is certainly key. Along with information is unfortunately a lot of misinformation. And for patients to be as informed as possible is obviously to their benefit. Looking at, again, some of those reputable sources and web pages is probably a good first step. One thing that we've talked about before is don't pick your procedure, but pick your provider. Picking your provider means somebody with experience, somebody who has all the skill sets of making the right, and not only the right, but the complicated diagnosis, and being able to address the combination of issues. Hip pain, back pain, knee pain is not just, cartilage damage and arthritis, and oftentimes is much more involved. So I would say that that's probably the important first step. And for those who are, secondly, and for those who are interested in learning about Richard Kim medicine and the next steps with us, certainly they can give us a call. Our phone number is 518-871-9900. Or they can go to our webpage, which is richardkimmedicine.com. On the events page, we have a list of our in-office and regional forums or seminars, and certainly attending something like that and talking to us can certainly help people get a better idea of who we are and exactly how we do it.
That's all the time we have for today. Thank you very much for joining us at our podcast. And again, that website is richardkimmedicine.com. Thank you very much.